9 out of 10 patients that are obese or overweight we see in the office without any issue whatsoever. So that's not a disqualifier. It's not to say that patients with obesity should not be seen in the office. That's not true at all of us as anesthesiologists have a particular risk tolerance for any kind of condition we see that may not be ideal. And obesity is one of them. So I would say that a lot of the times I see patients in the office, no problem.
Dr. Johnson, children as well as adults, but we're talking about children here now, for many, many reasons would benefit from an anesthesia, getting more work done, getting it pleasant done without any major trauma. By doing so, getting it done at all, but pleasantly is obviously good. I mean, we all try to make our life pleasant. However, there are some situations which children have, which needs to be well known, and parents need to be well in communication with you, and also well, need to know what's going on. And for instance, if a child is obese, which I'm not really sure what that means, I'm not so sure every parent knows it right away when that starts. Could you shed some light on that? And could you shed on the importance of what parents need to know if and when their child is obese and yet has some reason that anesthesia would be good in order to get dentistry done without too much trauma?
Sure. I mean, we see all kinds of patients, right? And not every patient is healthy necessarily, and we know that, right? So that's not an issue. It's just a matter of tailoring and changing the anesthetic to be able to fit the needs of the particular patient. The vast majority of patients we see all the time in the office without a problem. Whoever is not seen in the office can often be seen either in a surgery center or a hospital setting, depending on what it is. So, like I mentioned in previous videos, there's some asthma, Down syndrome, some other syndromes that children or adults may have that may not be ideal candidates for the office. You mentioned obesity, which is an increasing problem in society in general. And a lot of the kids I've been seeing over the years are a little bit bigger, but we see kids that are obese or overweight in the office all the time, and we do so safely. I would say to you, 9 out of 10 patients that are obese or overweight we see in the office without any issue whatsoever. So that's not a disqualifier. It's not to say that patients with obesity should not be seen in the office. That's not true at all of us as anesthesiologists have a particular risk tolerance for any kind of condition we see that may not be ideal. And obesity is one of them. So I would say that a lot of the times I see patients in the office, no problem. I would tell you within the last 3 months, I have turned away 2 individuals because what we call their BMI or body mass index, people may be familiar with, was just too high for them to be seen in the office safely. So I had a conversation with the parents, with the adults, so that they understand that their child can be seen, but may not be able to be seen in the office for various reasons. And I shared that with them because the ideal is always to treat any individual in the office safely, regardless of whatever the issue is. We wish we could see everyone, but it's not always possible.
So, and when you see in the office, but not in the office, but can be seen, that other place is what? A hospital?
Other place, maybe a hospital or surgery center. It would all depend. And
Okay.
like I said, I rarely have to turn patients down for that, rarely, because even if the kids are a little bigger, that's okay. It's what it is, and we deal with it, and we make sure that the kids are safe regardless. However, like I said, there are some patients in my career that I've had to say no to for in-office anesthesia because I felt the risk would have been too great. And these were individuals with BMIs over 30, 33, which represent severe obesity and could complicate the anesthetic process and recovery. All those things can be challenging. And it's better to have it under an environment that they can be monitored for a long term. So that's the only reason. It's not that they can't be seen. It's just that they may have to be seen at a different venue.
Right, I got that. So, however, um, like whether a little bit obese or lots of obese, which sometimes is a matter of opinion and all kinds of things enters in it. the person, the child, can actually be seen. So if a parent has heard out there that obese and let's say the kid is at the same time hyperactive and doesn't like dentistry,
Right,
like,
right, right.
and the parents goes, "Oh my God, I cannot put him to an anesthesia either because there are obese people, cannot." That would not be true either.
Oh no, that's not true. No, that's
Okay.
not true at all. It,
Very good to hear.
yeah, no, that's not true. We want people to understand that there are situations where your anesthetic may need to be altered, and that includes the location in which it's delivered to be able to see you safely. That's all we want people to know. But it's not that we cannot see individuals. It's just that the location may be different. But we want any parent or an adult for that matter, whether, if you're slim, overweight, obese, and you need to be seen, reach out to us, reach out to your dentist, and when we do our evaluation, we will make the best determination that keeps you safe and allows you to get your dental work done as well comfortably.
Right. So it is simply because it could, with a severe obese person, it could potentially not be a sit down, get anesthesia, get dentistry, wake up and go home.
Correct. That's exactly, you said it
It
very
could
well.
be more, and that cannot be done in the dental office anymore. So thus, you need to go into a clinical environment, and the dentist would go there,
Correct.
including the anesthetist or whatever it is.
Correct.
All
That is
right.
correct.
Well, thank you very much. This
You're
is
welcome.
very enlightening, I find. Thank you.